Hello, I'm Victor Yalom, and I'm pleased to be here today with Dr. Irvin Yalom, psychiatrist, writer, and professor emeritus of Stanford University, as well as my father. Good to be here with you today.
Good to be here.
Over the years, we've had many of our viewers ask whether they could see you doing therapy, and we do have some older videos of you doing group psychotherapy, and I've had a chance to work with you doing group therapy many years ago when I was training, but I realized I've never actually had a chance to see you lead therapy sessions, although we certainly get a good sense of that in your writings. But of course, that's different than seeing it on camera. Right. So I've prodded and cajoled you for a few years, and finally you agreed to see some clients on camera, real clients coming in knowing that their sessions would be video recorded. Okay. And we're going to start off with 2 sessions with a man named Gareth. He's nearly 70 years old, approaching retirement, has a lifelong history of some significant psychological difficulties resulting in pretty acute anxiety. He's turned in many ways his life around. He's in a marriage he describes very positively, but he still struggles with quite a bit of anxiety, and he jumped at the opportunity to meet with you for a couple sessions to see if you might be able to help him. So did you have any thoughts, or do you have any thoughts now about going in to meet with him for a couple times?
Oh, I can only imagine he's probably experiencing a good bit of anxiety about this important transition into retirement. Sometimes we think of retirement as being a relief, a vacation from lifelong work, but for a lot of people, it stirs up a lot of anxiety, has all kinds of implications about people, how people place themselves on their life cycle. It's got to bring up some important existential issues. I suspect we'll probably be talking about that a good bit.
Yeah. Let's move and see your work. We filmed the 2 sessions in their entirety, and then we edited them into selected segments that we thought really illustrated some of the important aspects of the way you work. We've added voiceover commentaries throughout, and then you and I are going to meet once after the first session, and then we will meet again at the end of the second session for some further discussion. So let's take a look at your work with Gareth.
Okay. So let's talk about the major issue. Tell me about your feelings about what's coming up in your life.
Okay.
You're 60.
I'm going on
70. Going on 70.
Going on 70.
I'll be 70 again.
But I'm in pretty good shape.
Yeah.
And there has been long history of kind of pretty fundamental challenges to my getting this far.
Fundamental challenges in terms of health or in terms of psychological issues?
Just psychological issues, existential issues, just persisting in the world, finding a way to be a part of it, taking care of myself, being safe.
Okay, well, those are issues we want to talk about. But let me just clarify the prostatic cancer episode that you had, 2009. That's the only serious threats to your life that you've had?
Yeah, that's the only serious life threat.
Otherwise, your health is good.
Otherwise, I'm in really good shape.
Good.
Part of the landscape here actually is that many of my relatives are quite long-lived. One uncle recently died at 105, for heaven's sakes.
Who was that?
My Uncle Russell, my mother's brother.
Yeah.
But others of her brothers were also equally lived, and then some, like my brother, died of presumably of a blood disease that he had in at age 65. My mother died when she was 42, and I was rather young.
So your mother died when you were how old?
I was 17. And she had a number of health crises throughout her life. She also had a nervous breakdown when I was about 1.5, 2.
What do you know about that?
I actually know a fair amount in subsequent years. So she had that episode when I was very little. Recovered, got on with her life, got breast cancer, it metastasized. She died at 17. So pretty much my whole life was kind of up and down.
Your mother was ill much of your life.
Yeah.
Right.
And that also included a lobotomy for the last 2 years of her life. So that was a pretty stressful one.
She had lobotomy?
She had a lobotomy.
For psychiatric reason?
For pain management, actually.
Okay.
The metastasized cancer went into the pain center of her brain.
Oh, dear.
And so it was, that's basically the point at which she died.
So you faced a lot of it during your first 17 years of life.
Yeah.
Right.
Yeah.
Right. And your father?
He was a Methodist minister during that era. My mother hated being a minister's wife. He hated being a minister. I, was thinking of going into the field myself, and he talked me out of it. He ended up teaching, retransitioning as a professor at a nearby college.
Yeah.
Taught marriage and family, sociology, world religions, and family counseling, and became an MFT himself. Studied at the Jung Institute in Los Angeles. Remarried another woman who was also a Jungian analyst, and became a Quaker. Lived a pretty good life, and I ended up having a really good connection with him.
So tell me then more about what's happening now. What's happening to you internally?
I find that I'm very anxious, that I have no idea what it is that I'm facing. I have very little purchase on what's inside of me to marshal, to address it.
Yeah.
I think I'm taking, outwardly appropriate steps. But inwardly, it's terra incognita.
Yeah. Well, tell me about the anxiety in any way you can. What's it like? How do you experience it? When do you experience it? What ideation accompanies it?
Sure. Well, it comes up a lot around working. This is just about the most stressful possible work I can imagine.
Yeah.
So it's kind of interesting. The courtroom work.
That's how you earn your living.
And that is how I earn my living.
Yeah. How often do you appear in court?
A couple of times a year. And then there is also depositions and, long hours, stressful deadlines, and demand for more or less instantaneous creativity.
And what's the anxiety like connected with that?
How to stay safe.
How to stay safe.
How to stay, because frankly, if there were some way that anything that I had said could be used against me, I expect it will be used against me, and that's certainly been my experience. I describe it as kind of like being a single individual responsible for managing the defense of a medieval castle.
Yeah.
And my expert report is my plan for how I'm going to defend it. The structure of the castle is the structure of the patent that I'm defending, and my job is to defend my expert report.
Defending.
Yeah.
Okay.
I'm in contact with a loose collection of others who do this sort of expert witnessing, and that's one of the things we talk about. That these kinds of challenges are one of the avenues, just one, but an important form of challenge to one party to.
Well, I see the precariousness and the risk, but tell me, if you get together a risk of a group of other people in the same situation, is your response about the same as them, or do you see yourself one end of the continuum or the other? What would you say?
triggers something in me that has
Something's
deeper
personal to you.
resonances
Than it might to others.
than it might to others.
Okay, that's good. Let's look at those deeper. It's not good that's happening, but I'm
Right.
saying good for our talk. So take a look at what do you think that means? How's it deeper resonances?
There have been a number of times in my career where I've felt very, very, very exposed. Like, I don't see really a path forward for me.
Well, tell me about being very, very exposed. How far is back?
Okay, I would go back to when I was 45. My first marriage was failing. I had a couple of young children. I was an academic teaching at one of the California State UCSD, so that's University of California.
You'd be teaching music?
I was teaching computer music.
Computer music.
Yeah, that's my specialty.
Okay.
Had a home there, was hoping for tenure. It didn't materialize. Marriage was on the rocks. There was no other work in San Diego that could possibly pay for me to afford to continue living there.
Right.
It was necessary for me to find other work. So just if you stop the clock at that moment,
right.
That reminded me so much of being two at my grandparents' house in Kansas, where I was farmed out.
Yeah.
At two.
You're farmed out because of your mother's illness?
Right.
Right, okay.
Not knowing what will become of me.
For how long?
For a year.
Wow.
Somewhere between 10 months and a year.
And that was at a distance from where your father and mother were?
Yeah, that was, they were at that point relocating to California from Arizona.
I see.
So, and we're talking 1948, 49 here, which I'm sure you remember, getting a long distance phone call was hard.
Yes, right.
In those times.
So
much more likely
you
with your
cut off from contact then completely.
Yeah.
Your brother was more or less out of that.
Yeah, he was with the other grandparents.
I see.
So I think I saw him once during that year.
Okay. Well, tell me some more.
Okay. So there's a kind of the way in which all this is relevant to now is these experiences in some way went in, I guess you'd say, at a formative age.
Yeah.
And I know they're there.
Yeah.
But they keep surprising me with their persistence.
Right.
And I know that in old age, I am eventually going to be, again, in a position where I'm being taken care of. And frankly, that terrifies me.
Okay. Are you saying, though, the memories of, say, what happened then with the tenure, or what happened with your wife, are experiences and images connected to that come back to haunt you? They're fresh in your mind?
Yeah. That there are situations that I'm going to be in where I will not be held, as I have not been held in some pretty dramatic circumstances throughout my life.
Yeah. How about currently in your marriage now?
Currently, I'm just fine in that regard. And so these thoughts are really inappropriate for right now.
Right. It's inappropriate because you've got some assurance if you lose your rational mind that you will be held, that you've got a family that will respond to you.
But in any case, I know that what really awaits all of us in the end is we can't care for ourselves.
What do you think about that?
Something that I'm successfully managing to fight off by staying healthy and viable.
Right.
But I know it's just a matter of time until it becomes, and so I'm trying to orient myself.
Yeah, you have to prepare yourself for that. But right now, though, you're already starting to suffer a lot of anxiety about it.
It's there. I know it's there. I know from my history that it has colored how I've dealt with things perhaps not very well over the course of this life as a consequence of this coloration in my experience. I would really like it to not be inappropriately asserting itself now.
Yeah. Well, how uncomfortable are you nowadays thinking about it?
You know, it's pretty much on my mind a lot.
Yeah.
So just earlier today, I was at a cafe near my house, and a woman came in with a stroller.
Yeah.
And I think, okay, what if that child in the stroller grows up to be the nurse who's pushing me around in a stroller,
I see.
for example.
Right.
So there's kind of an involuntary creative component that is keeping this issue before me. Now, maybe that's a good thing, because...
Well, so the content of that is that one day I'll be so old that I'll need someone to care for me and push me around in a stroller just as though I were a child or a helpless child. Okay. Up until this point, I'm simply doing what I assume any therapist would be doing in the first session. My goal is to try to understand what brings him into therapy, which in his case is very intense anxiety. I do this by briefly exploring some of his past relevant experiences as well as digging into the specifics of his current situation. As we'll see, he makes some unusually clear connection between unresolved severe trauma in early childhood and how it gets reignited by analogous situations later into life. To understand these, a good exploration of one's early and current life are both necessary. And that's that's a pretty typical kind of thought, that you're going to be old and helpless and be pushed around by that child when he grows up. So you're very conscious of the passage of time and a generational shift right now.
Yeah. And it's been with me as a topic all along, and one that I work with and struggle with, a lot,
Give me more
many times a week.
Give me more examples of it.
Okay. I see Shiva sitting over there watching over us.
Yep.
I have a personal shrine with the goddess Kali on it.
Yeah.
And what she's there to do is for me to remember the transitoriness of my life.
Right.
And it's really, on one level, it's just the raw existential fact that I am not permanent, and that I have declining faculties that are declining all around me. Now my hands are arthritic.
Of course.
And I can't play the guitar as well as I used to, and I find names slipping out of my head and all of the rest.
Yep. Well, that's the deal. We sign on for, even though we don't quite know what we're signing on for, but we know that we're signing on for the life cycle, which has the ending that's unpleasant for us to think about. Yeah. Gareth initially presents with anxiety related to his work, but we don't have to scratch deep to find that lurking under the surface, he's also got very significant anxiety about the future, about being incapacitated and depending upon a caretaker, and anxiety about death itself. The first sets of concerns draws from anxiety from his past, including losing his mother's care when he was an infant. And all of us are threatened by death, but it's uncommon that this surfaces so prominently in a first therapy session. I will make every effort to accompany him as he proceeds to explore this further and signal to him by commenting, that's the deal we sign on for. Is it entering your dream life?
Yeah, it does.
Can you think of a recent dream that you've had last night, or?
Yeah, not last night, but
a strong dream.
There was a strong dream where I was driving in an old sports car that I used to have, an old Carmen Ghia.
You did? How long ago?
What's that?
How long ago?
I owned the car until 1998.
Okay, so that car was about 20 years plus or so away. Okay,
Yeah.
so you're driving the Armageddon.
And I pull into the parking lot of an ancient shrine.
You pull into the parking lot of
an ancient shrine.
Okay.
That's in ruins. I would actually call it a ruin. And there are big boulders heaped up everywhere.
Yeah.
And I get out of the car and close the door and turn to face the ruin and realize I forgot to set the emergency brake in the car. And it's now slid back and crunched into the curb. Nonetheless, I turn back and face the shrine and walk toward it, and my left shoe becomes caught between two of the blocks of rubble. And I'm wearing pretty tightly tied shoes, but I tug on the shoe and the shoe rips open. And you know how at the end of a long hike, you take off your boots and there's this really delicious feeling that comes that your foot is now free. And I had that experience, that feeling of liberation. So, it occurred to me that
that's the end of the dream.
That's the end of the dream, right there. Just that delicious feeling.
The emotion in the dream was by and large not unpleasant.
No, it wasn't. And certainly the end of the dream was exquisite. That feeling of liberation.
Come to the journey, even though things are in ruins, there's some relief.
Yeah, from shedding.
End of the struggle.
Yeah, from shedding this foot that was binding me.
Right.
Shedding the shoe that was binding me.
Right. I invariably inquire about dreams in the first session. Sometimes the dream on the night before we meet conveys information about the patient's hopes or dreads about therapy. This particular dream is unusual in that, despite the patient's considerable anxiety, here in this dream, death is described positively as a release from suffering. Usually the dream is heavily concealed, and much work is required to reveal its meaning, whereas in this case, the patient's already done a good bit of inner work to bring meaning to this dream. What else is there that you fear?
Massive inflation, chipping away my assets until I'm back eating dog food. I subscribed to The Economist during the Great Recession in 2008. I read it almost fanatically every week because I don't want to be taken by surprise like that again. Right. But then I know that with declining faculties and the passage of time, there's going to be a point where I am not going to be in charge. And yet there is this fear that has been carrying throughout my life that would, if I don't figure out a way to address it, could ride on my shoulders at that point and make and deprive me of the release that I so much want.
Yeah. Well, there's one fear we haven't talked about today, but it's got to be playing a role here somewhere. That fear, to me, frankly, seems very irrational. I mean, it does to you yourself, but there is a real fear, which is a fear of dying. And where does that enter into this? Is that the thing that you really fear?
Of course.
Because the others don't make sense, but dying, the thought of that makes a lot of sense because it's inevitable.
The root fear all along that has driven the anxiety has been fear of death.
Yeah.
To be bereft of my parents was a death fear.
Yeah.
Then when she contracted fatal cancer again in adolescence, it seemed like a replay.
Boy, you've had a big dose of it.
Then my family flew apart, scattered to the winds. My father remarried badly. It was time for me to be out on my own, and so it was as though I was shot from a cannon.
Shot from a cannon, yeah. Your father remarried badly when you were how old?
When I was 19.
19. And then the family just flew apart.
I didn't have anything to do with him after that point.
With your father and your stepmother?
And my stepmother.
Well, when that? What happened?
Well, first of all, I had to beat the draft. Vietnam was raging. More young men were being killed when I was 19, 20, and 21 than any time since World War II. So that was another death anxiety.
Yeah.
Very realistic.
What happened to you?
I was fortunate to be able to join the Peace Corps and served in India for a while and came back, filed for conscientious objectorship, and struggled with the draft board. The reason I came back from India was in part due to health concerns. The draft board heard about the health concerns and decided that I should be 4F. So,
what kind of health concerns?
You know,
got a parasite, or?
Yeah, I got a bunch of really nasty parasites that the military didn't want passed around. Yeah. But I got over them, and life went on.
Yeah. So that was paramount in your mind for a few years here.
Yeah. So, but up until 24, it was all about just hanging on to life.
Yeah, staying alive.
So in that last segment, you explicitly bring up the idea that underlying all of his anxiety throughout his life has been the fear of death, and he really kind of responds favorably to that interpretation. It seems to really make sense to him. It seems like something he's already thought about, but I imagine you don't always get such a positive response, especially in the first session.
Well, death, death comes up in various ways in psychotherapy. I know when I first started working on that book on existential therapy, I was really struck by the fact that I was dealing with concerns about my own death. I was working with a lot of dying patients. I was trying to work on these issues. I was aware that death almost never enters the arena of psychotherapy. I went through many years of my own therapy, and it never once arose. So yes, I've tried to put death back into psychotherapy because I think it's one of the major fears that we all have. Every single one of us are dealing with this on one level or another. Gareth talked about retirement, and that in itself is a lead into talking about maybe even the greater fear. Retirement has lots of concerns with people. What will I do? How will I spend my time? My whole meaning of life is vanished now. But also it signifies a major life event, and it's a prelude to dying. People are always concerned about that. Gareth had a couple of interesting issues, though, because as he thought about aging, he was terrified by the idea of his being unable to take care of himself. He had such terrible child care experiences when he was young, losing his mother, being farmed out to his grandparents. So he was very frightened about that. But underneath that, too, I wanted to give him the opportunity to talk about what's got to be there, some of his fears of dying.
Yeah. All right. Moving on to one other topic. You asked him about dreams, and he readily produced this most detailed dream, and which, again, both of you interpreted, in a sense, about death and release. But I was interested in your thoughts about working with dreams in general.
I usually will ask for a dream in the very first session. I like to look at the first dream. There's a long mythic view of first dreams started by by Freud's practice, because sometimes the dream dreamt the night before therapy starts sometimes gives you an interesting, deeper, unusual look into the patient's whole dynamics. It's almost as though you catch the dream maker unaware, and that the dream is unusually revealing. So, yeah, I like to look at the first dreams, and I look for what they're going to feel about therapy and dreams. I asked him that he didn't have a first dream, but then he brought up that interesting dream about death, where it's a release for him. He's released from his shoes, and that had very much to do with his own spiritual practice and how much he's been thinking about that a good bit. Therapists today don't often look at dreams, but I have many a good therapy session which really focused on dealing with the dream, learning something about what their underworld is like inside. I'm not trying to interpret a dream. I mean, that could go on forever. Who'll know when the dream is fully interpreted? But talking about the dream, then asking for association, patients will bring up all kinds of interesting things, present life and past life, they might otherwise never have talked about.
All right. So it's kind of, you're looking to them for their associations to it. You're often asking them of what their experience, what their feeling was in the dream.
Exactly. Right. Yeah.
And
I'll ask for association. Just let your mind go free. Think of that person. When did you? And then I try to see. Well, first of all, I'll try and look at what happened the evening before the dream. What was the day's residue? Was Freud's term for that? How did some of that get incorporated into the dream? I know we don't have time on this thing, but I could be glad to talk about first dreams I've had of patients.
All right.
This last few weeks.
Or we'll catch up with that later. Okay, so let's now move ahead and look at your work with Gareth in the second and final session you have with him, and then we'll meet one more time to discuss that.
Okay.